New numbers out of Manitoba suggest Winnipeg could be one of Canada's newest COVID-19 hotspots. The province is reporting 146 new cases today, a record daily high for the fourth time in the week, and a majority of those cases are in the capital. And the test positivity rate in Manitoba is above 4%, also a new record. We want to check in on how things are going there with Brian Bowman. He's the mayor of Winnipeg. He, of course, joins us from that city. Hi, Mayor. Good to see you again.
Good to see you. Thanks for having me.
This week, the province's chief medical officer said that he's running out of targeted tools to curb the spread in the province. Do you think some sort of, and I don't know what exactly it looks like, but maybe type of lockdown should be on the table?
Well, I hope that's not necessary. I know that our business community and governments have been trying to build in the resilience that we need for additional waves of this virus. We've learned a lot from where we were in April, for example. And so we've been bringing back staff and bringing back operations of our municipal government in a way that is sensitive to the fact that this virus is still out in the community. But the numbers you just referenced, we're following very closely. They're being released daily from the province of Manitoba. Nearly 1,200 active cases in the city of Winnipeg. The positivity rate of, I think, 4.4% is really concerning. And today we've never cracked 100 new cases in a day. 114 today is really troubling. And so it's a reminder that we all need to get back to the fundamentals that we've been hearing from public health officials for many months. That those fundamentals are, washing your hands regularly, wearing a mask, and watching your distance. And we're reminding our residents to continue to do that and redouble your efforts.
Is there a sort of marker or indicator that you're looking to in order to determine, and obviously the province is involved in this as well, but in order to determine whether or not more stringent restrictions are necessary? I'm thinking, for example, of hospitalizations, which became a key factor here in Ontario.
We've been working since the beginning of the pandemic with our provincial health officials, and they're the lead. And so we're working with them. We have brought in our own measures. We introduced mandatory masks back in August for all city facilities. We've made it a requirement for all city-issued phones to download the new COVID alert app. We think that's one way in which we can help, because we know if more people are on that app, the better it's going to be for its effectiveness for the broader community. And so we'll keep all options on the table going forward and see what we can do to support Manitoba Health, though.
Okay, let me ask you about the conversation you had this week with the Prime Minister, because a couple of things in the readout jumped out to me. And the first was around testing and contact tracing, that was something that was discussed. Is there an issue with testing in Winnipeg or in Manitoba from your perspective?
Well, I mean, the Premier actually acknowledged that there were some improvements that were needed, and we're hearing that concerns primarily about how long it takes to get a test. The province added a seventh site, a drive-through site yesterday, and we're hoping that this is going to help mitigate and alleviate some of the concerns. Also concerns about how long it takes to get test results back. And so there is an urgent need to improve testing here in Manitoba. I know elsewhere in the country. I had a good conversation with the Prime Minister yesterday about our efforts to work with our provincial counterparts. One of the ideas that I pitched was really for provincial governments and the federal government to better leverage the emergency operations expertise that resides in Canadian cities. We know we've got personnel who are trained in emergencies like this. And we are playing a collaborative role with our counterparts with Manitoba Health. It's increased in recent days, and we're going to do what we can to support their efforts.
What does that mean kind of in layman's terms when you say leverage emergency supports? Do you mean emergency workers or systems that are already in place where testing is concerned, or something else?
No, well, we have, in our case, we have an emergency operations center, and we have we have a chief who oversees those operations. And so these are folks who are trained in dealing with emergencies, and they have expertise that they're lending to provincial counterparts on consideration. So testing sites, everything from traffic management, we've provided input on traffic management to even the need for bathrooms when people are waiting in line. So we've got that expertise to help our provincial counterparts. That's what we're doing, and I'm thinking that across Canada, the more that those experts can be tapped, the better it will be for the coordination and the collaboration between all three levels of government.
Is it a capacity issue where testing is concerned? Do you think, and I ask because the Prime Minister gave an interview to a local radio station in Winnipeg this morning and said something to the effect of some provinces are not meeting the mark, implying that there were targets really for testing. I'm not sure whether Manitoba falls in that category, but the insinuation seemed to be that it was. Is there some sort of conversation ongoing about boosting that capacity?
Well, firstly, I appreciate the Prime Minister's outreach. He reached out to me yesterday to have some dialogue on what we're all doing to help. We want to see the speed of which Winnipeggers can get into testing improve, and that's something that the province has heard loud and clear and has acknowledged publicly that they need to get people in quicker. We hear reports of people being turned away from testing sites. The concern, of course, is people aren't going because they're hearing that it's difficult to get in. And when folks are symptomatic, obviously we want to make sure that they stay home and if necessary, they get tested. And so that's the real concern, is just getting people into testing and doing it in a timely way. And that's something we're going to keep encouraging our provincial counterparts to keep making improvements.
I just have about 30 seconds, Mayor, but I wanted to ask you about contact tracing. Is that working right now, do you think, or could that be boosted as far as capacity goes as well?
Well, that's something that I know the province is much more hands-on than we are. The contact tracing alert app is one way in which we're trying to support their efforts. And so improvements for contact tracing obviously is important, but our primary concern, what we're hearing from Winnipeggers, people just need to be able to get into the testing sites. And so there needs to be increased capacity to get people in a timely way.
Okay, gotcha. Thanks so much, Mayor. I appreciate you making time for the program this evening.
My pleasure. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.